Hi everyone, welcome back to the Hair Loss Show, and in this episode we're going to go through part 3 of our Q&A, so stick around for a few more questions.
Welcome to the Hair Loss Show. Dr. Russell Knudsen and Dr. Vikram Jayaprakash discuss issues relating to hair loss and the medical and surgical treatment of hair loss in both men and women.
Right, so we're going to go through some more Q&A and the questions that have been submitted to the community page. Thanks again for submitting all your questions. And once again, thanks again for all your support. Please remember to like and to subscribe to the channel. So for today's set of questions, the first question is from Stephen. And the question is, how probable is nerve damage during an FUT procedure? Is it easy to avoid for an experienced surgeon? That's a good question. And the answer is, look, it can happen, all right? Everyone is an individual. And so we know generally the nerve supply from an anatomical distribution in an individual, but sometimes people have aberrant nerves and sometimes the nerves are slightly more superficial. So the reality is, you do get people that have some altered sensation at the back of the scalp if they've had an FUT procedure, but that usually settles, all right? Usually settles within a maximum of 2 to 3 months. But you can't see nerves, so there's no way of predicting. What we're trying to do with FUT surgery is go quite superficial. We just want, the layer that we want to take is just below the bulb. So hopefully there's no major nerves that come through that carry a more superficial course. So more than likely, there's very little chance of any nerve damage. Sometimes we do warn patients there's some altered sensation over the area of the scar, but like I said, that does settle within a couple of months' time. So hopefully that answers your question. Right, the second question from Sean. What are the best options for controlling dandruff while using minoxidil? And is this bad for hair regrowth? I do use Nizoral shampoo every 3 to 4 days, but it doesn't seem to work. Right. So this is a great question, and it's kind of playing whack-a-mole, right? So that old game where, a mole comes up, you whack it, and then it comes up there and you whack it there. So the issue is that the dandruff is probably being caused by the minoxidil. It's because we know that topical minoxidil, especially the liquid, the carrier base in that is propylene glycol, and probably about 30% of the population have some form of sensitivity to the propylene glycol. So if you're using the topical minoxidil and you're getting skin irritation with that, which causes a flaky scalp, and then you're trying to use something else to try and get on top of that, there's potentially side effects of that as well. So in my mind, we've got to think, right, well, how do we prevent this from happening in the first place? And one of the most easiest changes to make is by changing the formulation of the minoxidil that we're using in the first place. And so if I see a patient of mine that complains about any scalp irritation, I'll say, right, well, let's trial the minoxidil foam, because that doesn't contain the propylene glycol and is less irritant, and you may find that you don't need to use any of the other agents to try and get on top of the scalp irritation. So try switching the formulation and see if that helps. And hopefully that answers that question. And great. The next question from, again from Sean, a different Sean. If you're in the early stages of thinning and have started finasteride, could you use minoxidil for a short period, say 6 to 9 months, to grow back some of the hair and hope that finasteride will keep it without the need to maintain minoxidil daily? So we've done a number of videos on this topic, and what I mean is that the difference between minoxidil and finasteride. Finasteride is an enzyme blocker, so it blocks the 5-alpha reductase enzyme, so lowers that level of DHT in the system. Minoxidil, on the other hand, is directly trying to stimulate that hair to grow. So they work in different ways, but what they're doing is to try and stabilize this condition. And so minoxidil is trying to thicken the hair up, and finasteride is trying to stop what is essentially trying to miniaturize the effect of trying to miniaturize that hair. So they work in different ways. So it's not something that I would sort of go, right, use this for a period of time and then use this. Ideally, if you're losing hair and if you've got male pattern hair loss, then this is a long-term condition, is a long-term process that you have to think through. And in my mind, what you really want to do is you want to be on the least amount of the least dose of the least number of things. All right, so it's about finding what is that for you. So make sure that you have a consultation with someone who knows how to manage this and can be able to advise you appropriately. In some people, it's just using a single agent, be it minoxidil or it can be finasteride. Some people, it requires a combination of the two. But seeing how effective a single agent is probably beneficial, and then you can always add a second agent in if you need. But it's not something that I would do sort of preemptively and then pull back because you don't know what the consequences of that decision will be. So try, if you can, stick with one agent, and if you need, add a second agent into the mix. So I hope that answers that question. Thanks again for watching. That brings us to the end of this episode. We've got some more questions. Join us again on episode number 4 and we'll go through that. Thanks again for watching.